Hey, folks, we're back. We're at Circuit World. I'm your host, BKP. It's time for Ask the Doc with Dr. William Whaley. I was afraid you'd jump in. I had to roll.
And it's not even raining. We could.
But he tries to take my entry sometime.
It's
right?
64 degrees, and it's not going to rain for another 2 hours.
That's why I'm here to referee.
You're
What?
That's why I'm here to referee.
Oh, okay.
you don't have the shirt.
Oh, I know.
He's got a striped shirt on.
Yeah, striped shirt.
It's time for Ask the Doc with Dr. William Whaley.
How come
Thank
we
you.
don't have one of these shirts with FYN on it?
Huh?
Everybody gets these shirts, that say Corona beer, or say they used to say Lipitor and stuff on them. And Obama made it where that was against the law. We don't even get pins anymore that say Lipitor on them. All we get now ones that got lawyers' names on them or funeral homes' names on them. And I think FYN would be better than funeral home shirt.
Huh? You know where I got this shirt?
Probably made it.
No, my mama got it for me.
Well, that's nice of her, wasn't it?
Isn't that nice?
Did she buy 100 of them, did she?
No, can we get to...
I bought 50 T-shirts that said "Elect Dr. Whaley" on them. Did you see the pictures?
No.
Well, I have to send you the pictures. They're good pictures.
Do you have a shirt?
Did
I
you
have a
see-
shirt. I wore a
Okay,
shirt.
I am going to...
Did
whether
you see
they,
the pictures?
I got a picture.
where they...
No, did you? Okay.
Don't... Hush. Oh. Thank you, Georgia Cancer.
Do you feel out of
Specialist,
control this morning?
Northside Cancer Center. No, I absolutely love it. You two guys are great. We focus on two questions, Dr. William Whaley, Dr. Raymond Tidman. We focus on two questions. Then we get into the news of the day. If you've just joined us for the first time, Dr. Whaley does. And we explain, and that is care. That's your tie for, why am I drawing?
Preventive medicine.
Preventive medicine.
Because
tie.
when we get to the news of the day, you're going to we're just going to redo one of the things we've been doing for the last year, because it's a tragedy about delayed care. All right, we're going to go to work here. We have two questions today. Both of these questions are a bit unusual and touch on sort of behavior and quality of life issues. The first one is a follow-up, really, to the discussions we had last week. It's quite interesting. My sister is 64 years of age. 2 years ago, she had stage 3A triple positive breast cancer. Last week, we talked about triple positive breast cancer. It was unusual. I'm going to flip through that in a minute. You talked about triple positive breast cancer last week. She refused her chemo after one dose. She had a heart attack at age 50, so that means she had a heart attack about a decade before she got the cancer, and has no heart issues now, but she refused the antibody drugs. Now, you remember we talked about hormones, radiation, kill it from 90 different ways. The antibody drugs, the doctor would have to have told her there is a 3% chance that with those drugs you may get a decrease in the contractility of your heart. The drugs may have to be discontinued. But it's just like lots of other things. We say, look, we're going to watch for it. If it happens, we stop it. But she decided not to take it at all. She had a mastectomy and was given a Remedex. So they didn't give her. They gave her chemo, which she didn't take. They gave her the antibodies, which she didn't take. And then they put her on the hormones, remember? So they did a mastectomy, so there wasn't a role for radiation. And that one last week, it had been a lumpectomy, so that patient got radiation. She stopped it on her own when she had pain in her leg that turned out to be a Baker's cyst. Baker's cyst is a thing in the back of the knee. It's not an injury. It's a little more common in overweight women, but it becomes painful. It's sort of like a bubble of bubble gum, and when you bend your knee, you're putting pressure on it. But it has nothing. That pain has nothing to do with the muscle pain or bone pain that people think they get from cholesterol drugs, Ray, right? Or these hormone drugs. So anyway, she stopped it when the pain in the leg turned out to be a Baker's cyst, and she started Femara. That's another drug. So the doctor said, okay, we'll get rid of that drug. We're going to give you another one. 3 weeks after she started that, she stopped it because she had a numb hand. That turned out to be carpal tunnel. That also is not related particularly to cholesterol drugs are these things. All right. She started another drug in that class, which she took for 3 months, and she stopped it 3 months ago because she said it made her back hurt when she slept. Her oncologist has said that none of her prior symptoms were related to the drugs she was taking. He said she was non-compliant. She puts that in quote marks, and we agree. So I guess the family thinks that she's not following instructions like he gave her a prescription for tamoxifen 3 weeks ago. She has not filled it yet, so that she's still not quite following advice. I know she had quite a few positive lymph nodes, so that means the cancer was fairly advanced. It said 3A, so we'll show you that just briefly. What is your advice to her and to us, her family? Well, this is really complicated, and this gets into find somebody you trust, talk to them. You got PCPs, you got preachers, and everything else. Put up that first slide there. Non-compliance. Ray, look at this. What's that say?
Oh, it's a code for it.
It's code.
It's a juvenile code, though.
That's a big deal. ICD-10 Z down to 1.1.
Can I say something before you get into this?
Yeah.
You know, when I read questions and I read something, I try to pull out what I call some of the strongest areas, and several times in here. But the strongest is she stopped it on her own, to me.
3 times.
Right.
Well, 4 times, actually.
I mean, I don't know. Now, medically, I know you're going to talk about all the things she could do and should do, but 3 times she made a decision.
Yeah, that's right.
Right?
That's right. That's why she's called non-compliant.
You know, can we take that word for a minute and break it down? Because this question is all about non-compliance. And it's interesting in our society that we use that word. This lady's not incompetent, as you're alluding to. She's a competent person, and she can make her own decisions. And yet we say she's non-compliant. Well, she's deciding she's not going to do it. I mean, I can't tell you the number of, and I'm not picking on my country folks up here, but, you know, men who are drugged in by their wife because their blood pressure is going crazy, and we have a little talk, and we talk about their cholesterol, and the husband's doing this, and then on the way out the door, you know, as she goes out the door and I'm following behind him, I said, "You're not going to take this treatment, are you?" And he goes, "No." I'm going, well, let's not waste our time here. You know, he's not going to take it, but he's going to listen to his wife and come in and hear about it. So, I mean, but that's his choice. That's his choice. I don't want to be disrespectful.
Medically, and as the audience knows that's been here, I respect medically where you go with these questions, but I don't find that individual. I don't like the word compliant.
Yeah, that's what I'm trying to get.
That's what he's trying to say.
Right.
Okay.
I mean, I understand.
Well, I tell you that the powers that be must love it because they gave it an ICD.
Yeah.
Right.
Oh, yeah.
I see that. Right.
All right, put that next one up there that's got those lymph nodes on it. This is going to be very brief. We did it last week. But this patient, she said it had a lot of lymph nodes. You remember the triple positive we'll come to in a minute, but stage 3A, you've either got a big tumor and not too many lymph nodes, or you can have a small tumor and a bunch of lymph nodes. So that's what this shows. She had a bunch of lymph nodes. It would say 4 to 6 lymph nodes positive to get to that stage. Well, she doesn't know how many, but 4 to 6 is a bunch of lymph nodes. So they probably took out, 15 or 20, and somewhere between 4 and 6 were positive. You can pull that down. Now we're going to put that next one up there, and this is going to be up briefly, but you remember that triple positive cancer of the breast is 10%, right? It's not a high number. You can pull that down. We were very encouraging to that family last week because that patient had earlier stage, right? Mm-hmm. And had surgery, radiation, chemotherapy, hormonal therapy, and directed antibody therapy. This patient really, when you get down to it at the end, has had only surgery because every other one of those things has been dropped out. So we got to try and get this patient to take something. We want her to take something if she will take something. Okay, put the next one up there. I don't think this woman is wrong. What's that say? Aromatase inhibitor associated bone and musculoskeletal effects. New evidence defining etiology and strategies for management. Okay, pull that down. This is a drug that at least 40% of people who take it will have some musculoskeletal, bone, joint, tendon, or something issue with it while they're taking it. Now, we're not treating athlete's foot or dandruff here. We're treating cancer. All right? I mean, so it just doesn't make your hair fall out. I mean, you're not making you hug the toilet, but if you're hurt, you know, you gotta respect it. Now, you can put this next one up. They aren't going to be able to read it, but I'm going to just read you a few things that can happen with this drug, and you'll find out. One of them's called de Quervain's tenosynovitis. One of them's called trigger finger. One's called carpal tunnel syndrome. Remember, she had carpal tunnel syndrome. And one is called generalized arthralgias. Okay, pull that down. So this generalized arthralgias are what the people complain of that are taking statin drugs. But remember, when somebody's on a cholesterol drug, they're probably fairly old. And fairly old people hurt all the time. And generally, that statin drug didn't cause them to hurt. But they read it in the thing they gave them at the CBS at 10 pages, and oh my God, that's why my back hurts or something. So anyway, the truth about this patient is she may well have had 2 or 3 of these issues with the different drugs. All right. Here is, what we got here? Algorithm.
Yes, algorithm.
All right, well, we don't have any survival curves here. I apologize. Put that algorithm up there, because this is really pretty. This is typical from what a PCP or a non-surgeon now is going to do with a patient who's got bones and joints that hurts. Maybe they have a family history of rheumatoid arthritis, or maybe they've got a positive blood test or something. But these are people who are taking this drug. So the first thing you're going to do is you're going to what? Educate them and counsel them. They're going to be hurt. Then you're going to do lifestyle things. You got to lose weight, exercise, get up in the morning, start moving slow. You know, if that doesn't work, then you get down to where you get to. If the pain's not too bad, you take Tylenol, or you take non-steroidals over here. And if it's severe pain, you go to the physical therapist. You go do all that stuff. And you can, down here they got some of the things like glucosamine. I don't really agree with all that. But when you get down to the very bottom and everything's gone through there, including stopping the drug for a month and see what happens, what does it say? Switch to another drug in the class. Well, they've done that 3 times. And lastly, it says go to tamoxifen. All right, pull that down. So what they've done here is exactly the right thing for this woman. And the family has sort of taken it that the patient is not following medical advice, and the oncologist has to call her non-compliant to get through the ICD-10 codes to be able to counsel her and do things. But I don't know that he's negating what she has going on. And it doesn't say that he referred her to physical therapy. It doesn't say he gave her ibuprofen or he gave her, Celebrex or something. So we get to this last thing, and this is the Ray Tidman issue. What do you got there? You got a scale. Mm-hmm. We always say the hazard-benefit ratio is on the side of not doing anything. That's like chronic lymphocytic leukemia, watching weight. Or the hazard-benefit ratio is, look, go down there and get a bone marrow transplant. I mean, that's a big deal. You're better off with the benefit of a bone marrow transplant, even though there's hazard. So in this little thing here, you got, if you take tamoxifen, you don't have a whole bunch of stuff that's bad. And the aromatase inhibitors have a lot more symptoms. It has the hurting and the hot flashes and all that. And this stuff in the middle is about the same. Now you can pull that down. The reason that they go to these aromatase inhibitors first is they're 35% more effective than tamoxifen. So they will give you a better chance of not recurring, a better chance of not getting a cancer in the opposite breast. But once you have gone through this litany, and I would say You might want her to go to physical therapy and do some other things, but she's probably going to tell you, I'm not taking anything else in that class anymore. And now she needs a little more education about the tamoxifen, because tamoxifen was the first drug. People didn't complain much about it, and it will give her just about as good or close to as good as she is going to be able to get without the hormones and without the monoclonal antibodies. So I would tell you and your family, don't treat her like she's crazy. Don't treat her like she's broken some kind of rule. Honor the fact that she has had issues with this. Honor the fact that these drugs have side effects, and maybe her pain threshold's low. But whatever it is, encourage her to go back and talk to her oncologist, go talk to the PCP, go talk to her gynecologist, go talk to whoever in the health profession or nurse that she really trusts, because tamoxifen doesn't have those musculoskeletal things to amount to anything. So I would say families should step back from being critical. Don't you have the sense that they're being critical here?
Yeah, you're talking about what we talk about often is a team effect or a team effort from the doctors to coordinate the care. And I have this conversation routinely with patients. I say, look, I'm sending you
more
to
than twice a day.
Probably 2 or 3 times a week, but I say I'm sending you to the oncologist, and the one I'm sending you to is going to get on this cancer like ugly on ape. You know, they're going to look at whatever he thinks is necessary to whip this cancer. And it may come to the point where that you feel more whipped than the cancer. And when you want to stop, you're not going to want to disappoint him, and you're going to keep thinking, but so you come back and talk to me, and then I'll go down and talk to him and say, look, the patient's failing emotionally on this treatment. And they can't keep going there, but they don't want to disappoint you. And that may be the case sometimes, but it is their right to say, I've had enough.
But you brought up something there
Yeah.
that's very important.
Yeah.
When you said the patient's failing emotionally on this treatment, you know, we had to talk with the doctors. Is the treatment
I remember
too
you calling
strong?
me on the telephone
Yes,
from Philadelphia.
Is the treatment too strong? We you know, and it was always, Mom, do you want to take the next one? So I have to say to this family myself, I don't know what we would have done if Mom would have said, no, I'm not taking anymore. I don't know what we would have done, how we would have handled that, but it wasn't us going through
Well,
it.
I'd like
You know?
us to do what we're doing here is be much more upfront about it. And it's not always cancer. Statin therapies. I've been on statin therapies for 2 decades now.
Me too.
But one day I woke up out of the blue and I felt like somebody had been beating on me with a broom handle all over my body. It was so startling. I mean, I hadn't, you know, I must have run a marathon or something.
Sure you didn't have a seizure in your sleep?
I could have, or Lee could have been really mad at me. I don't know. But I even went to a neurologist saying, I don't, is this a neuromuscular disorder? I mean, I was completely baffled because I had been on these statins for 10 years and I was having a statin reaction. And it was startling. And so now when I have patients come in and they tell me that they hurt all over, but actually before I prescribe it, I said, you could be one of those rare cases. It could happen. And it could be 10 years into your therapy where you wake up one day and you just feel beat. You talk, don't quit it, talk to me about it, because I can hold it, I can stop it, I can change it, I can do all kinds of things. But what I don't like hearing is my cardiology brethren saying, well, because they call in and say they're hurting all over, and the cardiologist, therapist, physician says, well, you'll get over it. I didn't get over it. Then they're not going to take it. And so, yeah, you need to tell them up front, this can happen, and when it does, there are solutions. But don't say, well, just he quit taking it because he's mean or stupid or ignorant.
And that's exactly what happens frequently.
Yeah.
Well, you know, the one thing over the years that we've done here that on all the questions, no matter what they are pertaining to cancer, is where you're at in the treatment, the quality of life.
Well, that was exactly what I said as we began the day. Both of these questions we're having today are over issues related to the quality of life.
Right.
And so we call that survivorship, and we call that hazard benefit ratio. You're treating a human being here. You're not treating a chart. So anyhow, I just want the family to not.
Yeah.
They seem like they're critical. Don't be critical, and perhaps going to a physical therapist, or I mean, it doesn't say what was done there. If they were in our group, our oncology group, would switch drugs, explain it to them, talk about taking some Tylenol or some ibuprofen or Celebrex or something, and would consider giving them physical therapy, because we see this all the time.
All right, so thank you, Georgia Cancer Specialist, Northside Cancer Center. Now, in this next question, I'm going to give it to you, but I just want to say, when I start reading, my father is in excellent health, all right, check. 85 years old, ooh, that's a big check. Plays golf 4 days a week, check. Walks all 18 holes, check.
Well, now
now wait a minute, I'm thinking to myself, okay, where's the problem? I mean, I'm not worth it.
Go ahead.
You know?
Finish reading it.
No, go ahead.
You're doing good. You got it. Go ahead.
All right, am I running? He goes to aerobics classes 3 days a week. Oh my God, I feel terrible. He's 80. I've got to join an aerobics class this week. And takes Thursday off from exercise. He has had early stage of prostate cancer 15 years ago. My mother died 3 years ago. And he has a friend. Now, wait a minute. The question has friend in quotations. We have to do that for the audience. He has a friend. I'm sorry. I don't mean to get animated here.
Go ahead.
Trying to stay focused here. He has a friend that is 10 years younger. You go. I'm sorry. I got to get away from you. Go, buddy. 85 years old. Get off the golf course and has a friend 10 years younger, and he has not responded to certain. How would you put?
I would say the blue pill.
He's not responded to the blue pill. He wants to proceed with the relationship. Does he have options? Play 9 holes of golf. There's my answer. Cut it down to 9.
Priorities here.
Go ahead, wrap that up.
All right. So does he have options? Now this is the part.
Don't exercise Wednesdays and Thursdays. I'm sorry.
All right. So the guy has a performance issue. Is what we're talking about here. He says his PCP is reluctant to talk with him about this, and his urologist, that's the guy who took care of his prostate cancer, who was his good friend, is dead. Now, the guy's 85 years old. He's outlived his doctors and he's outlived most of his friends. What would you tell him to do?
Well, first of all, I want to make a claim right here on this show before we go any further. I have no idea who this is, but you're my hero.
Well, let me tell you.
All right.
No. This is good because one of the best ways to deal with this issue is humor. And because people are uptight about it, and they're who knows what kind of preconceived notions they got or shame they carry around it. And so, yeah, it's good to joke around about it.
I know I'm getting in the way.
In the office,
you're not in the least.
No, not in the least. I mean, I will tell my guys sometimes the wife sends them in. But when they come in and we start talking about this, I say, well, was there any place in your life where you wanted to become a monk? And they all look at me, well, hell no. And I say, well, we need to stop trying to be a monk here. Let's get some solutions to this.
All right, well, do I say this at the risk of getting in trouble? All right, he's 85. She is 10 years younger.
She's still 75.
So she's 75.
Yeah, she's got miles to go here.
What's wrong with checkers in the afternoon? Well, wait a minute.
No, that's terrible. All right, let's go.
Was that terrible?
Yeah, it was. All right. I want you to put this first thing up here because this is talking about a guy who's had prostate cancer at 85 years old. I want to try and tell you this is much bigger problem than 85-year-old people. And that's why Dr. Tidman and I have talked about this in the green room when we were putting on our makeup. This first pickup thing here says this is a common link between performance and cardiovascular disease. So this is so common in his practice of people, pull that down now, of people who have high blood pressure or they've had peripheral vascular disease or something. The medications can do it or the condition can do it. Now put this next one up. Well, this is not a survival curve, but this is an incidence curve. And if you look at this, at age 50, 48% of men, that's right at 50% at age 50, 50 at 50, have a performance issue. You can pull that down now. Now the problem is they won't admit it to themselves. They won't admit it to their partner, and they won't talk to the doctor about it. So they create this sort of a distance, emotional distance in their relationship. They get, they get hooked on baseball, or they start restoring old cars or something, so that their intimacy goes down. And a thing I can do about that, except increase public awareness about it, as Ray says sometimes the wife settle them in, but make people free to talk about it. Now, there's no survival curve on this one, but put this next one up here. This man, this is from a typical
Insurance scoring.
Scoring. Look, what does that say his life expectancy is?
98.
How old is he?
85.
It gives him you can pull that down now. It gives him a 75% chance of making it to 93, and it gives him a 50% chance of getting to 98. So this guy has got another 13 years of hopefully good health, and he ought to be treated like that. I used to take that joke about George Burns was having sex with Las Vegas showgirls till he was 99. And the issue is, you can't think of people of chronological age. You got to think about them by biological age. So what I would tell you is, yes, he's got options, and he needs to go find him another PCP.
Yeah.
Don't know where you live, but in Blue Ridge, there are a couple of urologists that have practices here or within
Or come up from
15
Atlanta.
miles.
Yeah.
Well, and there's some within 15, 18 miles here that are pretty much all the time. So he has outlived his friends. He's outlived his medical team. He needs to go find himself a urologist that's 50 years old and then talk to him about it, or go get himself a new PCP and talk to his PCP. Either one of those are fine, but there are options beyond those pills, and we don't need to talk about that today. But let daddy get some medical care, go back out and play golf, and have his friend.
I totally agree. And what you're saying to him is, look, the emotion in our intimacy relationships, confidence is a big thing. And obviously he's lost his confidence, even to the point of not seeking help and letting somebody who's not really being helpful lead him astray. So yes, get a little confidence here. Urologists deal with this day in and day out, hour after hour. I mean, this is nothing at all.
50% of people over age 50, but
So,
very few of them are
the
seeking
primary care
help.
You know what I
physician
want to
should
know?
be
You know what I want to know?
What?
What's his handicap?
I bet he shoots his age.
No, I'm just telling you this. I am not making light of this question. This guy is my hero. He's 85. He's walking 18 holes. He's playing golf,
I bet
aerobics.
I bet you on a good day he can shoot below his age or shoot 85.
I bet he's a good cook also. I'm serious. This guy, I mean, sorry.
he
I'm
probably-
not making.
I got the hint that he was probably quite successful in his business or
Absolutely.
something, because he's able to play golf. So obviously he's got someplace to go, and he's got a social life. Many people that age, they just go home and rock on the porch until the Lord calls them home. I give the guy a gold star, and particularly after the death of a woman he probably was married to for 50 or 60 years. She'd been gone for 3 years, and he's now beginning to get back into life.
I want to be very clear. I'm not making light of this person's question. I'm just amazed that this guy.
There's hope for you, Brian. Hope.
All right.
I knew that was coming.
Okay.
I knew. See, I wanted to. I didn't want to stop until you finally put that out there.
All right, I got a couple things we got to rub past.
I may listen to this guy.
We're
You've been telling me things to do for 5 years. I haven't paid very good.
But you gotta go to aerobics.
This
You gotta
question
start-
right here,
All right.
right? Seriously, have me.
All right,
All right, go ahead.
So we got to
the
get
news of the day.
well. First, we got to get to this
Okay,
percent positive.
8%.
Okay, we're clicking it down now.
Right.
How many Fannin
We want to be
County-
below 5.
How many Fannin County?
We had 98 last week.
And how many did we have 3 weeks ago?
74. And we're at the 100.
We're at 100. So Fannin County has now had 100 deaths. All right. Now, that gets us to the news. Where is it? Right there. Read that out loud, because this is about the 10th time we've said
Colon
that.
cancer diagnosis fell 40% in pandemic, and that's not good news.
I thought COVID cured cancer.
No,
Isn't that
it
what
cured
that's
the
saying?
flu.
Yeah, it cured the flu, and it cured colon cancer.
Yeah, by 40%.
I'm being a smart ass.
I know.
Yeah, I know. But as I said, though, remember now, before the 4th of July, the colon cancer diagnoses and breast cancer diagnoses and prostate cancer diagnoses were going back up again, because doctors had gone on and gotten their PSA, or women had gotten their long delayed mammogram, or even I told you a couple of weeks ago, my colonoscopy was delayed by 18 months. It's normal. But anyway, but since July the 5th, they've gone right back down again. Because people, even though we're out there working around now, but the number of people that are going in for their primary care checkups, the number of people that are going to get the teeth cleaned and their routine eye care and stuff, since July and the onset of this Delta variant have gone down like crazy. And that's not good. That's why I'm wearing my preventive medicine tie today. One more time, get back out there and go see a doctor.
Well, what's coming to my mind is when you're young and you like to go to scary movies, and you go in that movie and you're just gritting, and then the movie's over, and you walk out, sunshine in, it's like, geez, that was a bad movie. I look at this whole COVID thing as it's a bad movie. It was a bad movie when Dr. F, I call him, came out and first said we need to all run and hide and be really scared, and I'm going to tell you how to live your life. That's when the opening scene was.
You don't call him Napoleon like I do.
Yeah, you call him Napoleon. I just call him F, and that's his grade. So, we're out of this bad movie. COVID's treatable. People need to have a doctor that treats it, and they need to call that doctor as soon as they get it, and they need to do all the right things Bill and I've been talking about all this time. But this movie needs to be over.
Let me move this, staying with COVID and colon cancer and other preventative medicine. The news we get daily are all large metropolitan areas.
Yeah.
Okay. They never come on the news and say this little hospital here or this little hospital here. So let me finish here. I'm going somewhere with this. But we'll watch any news network and they're talking about ICU beds in Houston and Atlanta and Chicago, all over metropolitan. What this has done, it's really hurt rural healthcare.
And small businesses all over the country.
Well, rural healthcare. I want to go with rural healthcare because we have amazing healthcare in rural areas because we have a lot of physicians, specialists that practice in different areas 2 times a month. So you call the office and they say, the 2nd and 4th week of the month, I'm in Blue Ridge. And that's when you get your appointment, right?
Right.
We have a lot of very good specialists. We have good health care in rural areas, but a lot of our health care is based on cardiologists that come on Tuesdays and read results. Now, we can't get the testing done in rural hospitals, so the visiting specialist can't come in at certain times. You take a test that you could have routine test right down here in our hospital 10 miles from here 2 years ago that could have been done within a week and reviewed. There's times now it's 3-4 months or 2 months. Am I going down
a similar vein? Let me just put a more positive spin, or maybe it's
I'm not being negative on it, but I'm just saying what they've done.
COVID doesn't cure heart disease.
Right.
Patients have heart attacks. Patients need to get into cardiac rehab.
Right.
So what the frick is cardiac rehab being closed for COVID going to do for those patients for the last how many ever months? That's not fair. It's not proper. It's not healthy. It's ignorant. This movie needs to end. There's a whole reason why healthcare is developed the way it's developed, to try to diagnose and treat problems early.
Well, go to your news.
Well,
and what you said.
Okay. All right. Hospitals in Alaska, this began last night, have the authority to ration care. That's like we did in triage in Vietnam. This guy is not going to make it. Morphine, he's going to die. This guy can go right straight to surgery. They have 0 available ventilators in the 50-bed hospital, not where it is, and to get that patient to a place that has a ventilator is 1,500 miles. So they've got people who are going to need ventilators. And do you take somebody off? Or how do you value if somebody dies, who's going to be the next one that gets it if you got 4 people that need it?
You want to answer to that?
No, I don't think it's hard. Go ahead.
Yeah, get the ventilators out of the warehouse that we built and stocked in warehouses all across the country.
Well, one of the problems
roll up the door, send them 2 ventilators.
Well, the problem is that they haven't got anybody that can run them.
Or stay awake.
But I mean,
I don't understand the headline there, but like, when do hospitals not have the right to triage care? If you don't have enough help and support or anything, it's going to happen. They don't need to ask the governor, can we not treat this patient? We don't have enough people to treat this patient. That's what life happens.
Yeah, but you brought up something that is convoluted out there also. We don't have enough people in the field. It's not so much, and this is where people start saying, you know, where I could be wrong. It's not 100% the ICU beds.
No.
It's not 100%.
It's mostly staffing.
Right. Mostly it's staffing across this country that, you know, we need people.
And we have idiots running off staff right now.
Running them off.
Yeah.
Yo, and it's not a whole lot different than you can't get anybody to wait tables in a bar and a restaurant. I mean, we got a supply chain problem for toilet paper. We got a supply chain problem for human beings.
Well, that's what happens when you have people like Dr. F, who says run and hide and don't do your job. Sorry, I'm done with it.
I'm going to close this. I got the all-star panel waiting, but I want to say this. Where I was going with that earlier on rural health care, I know somebody that was told to schedule a colonoscopy, and the date they got back was just ridiculous.
Oh, yeah.
You know, and I'm thinking to myself, what if something's wrong between the window that you were told to get a colonoscopy, and we're focusing on that, and when they give you a date?
I saw one yesterday that got a January date.
You're right. And you told me this yourself. You have patients that, I don't know when you do it or if you say it to them, but you have patients that, you know, when they're gone, you think to yourself, man, I wish I could have got them here a month ago.
Yeah.
Right?
That's right. Yeah.
And
well, you brought up the community of healthcare and why one of the reasons why we're so good here. And I'll brag on Bill and a little bit on myself. When Bill came to this community, Bill was very connected to the good, best in Atlanta.
Yes.
And so,
absolutely.
I use him for cancer, but I also use Bill and say, hey, I got a really tricky pulmonology patient here. Who handles this? And he'll tell me. So a lot of the best medical care comes from being connected to networks of physicians who know who the really good one is for that problem. And it's just a reality of life. So part of our excellence here in Blue Ridge is that connectivity of some senior physicians who know how to get the job done.
All right. So tomorrow, I got to get out of this, but we talk every week, and you 2 doctors, I say to you every week, America has a real trust factor. Mm-hmm. We just don't know what to trust when we see someone come on and say, we got to do this, we got to do that. Whether it's mask our kids, give them a vaccine, and then you have a guy that comes on, he says, I don't know, it's too early to determine if we could gather for Christmas. We can't make it. Now tomorrow across this country, tomorrow across this country, we'll have 80,000 people in stadiums from sea to shining sea watching college football, and then you have somebody go
80,000 times 40.
Right.
Yeah, 40 different places.
Right, and they'll be watching college football, and then someone will come on TV and say, "Well, we don't know
if we can have Christmas this year."
Yeah, if we're ready. So we don't know what to believe. That's the only thing I'm saying is we don't know what to believe.
Well,
they're going to be in these college stadiums cheering like, "Let's go, Brandon," and
something else.
Right.
Listen, I have an answer for that, and I don't know whether it's me being a contrarian or me being an American.
Yeah.
Every
Maybe a
time you
little bit
see
of
one of
both.
those people out there telling you what to do, the letters are FYB.
You are quite the Cartarian, whatever he said.
Contrarian.
Contrarian, right? Contrarian. We'll get that. And
Contrarian.
what do you say? Are you a contrarian too?
No, I'm definitely not a contrarian. I read it in the paper today that I think it was IBM. Was it IBM that said 100% of their employees have to be vaccinated by November the 1st
Yes.
because they are a contractor with the federal government and they are
Under the gun.
and they have to fill that role. I remember when I established the drug screening program for the Federal Aviation Administration, and when we were doing so, several construction companies in Atlanta wanted to have a drug screening program for themselves and all of their subcontractors. So we put it in, huge construction company, people building 100-story buildings and stuff. So when they began doing urine drug screens on the laborers for the subcontractors, the positivity rate was 60%. Within about 8 weeks, people who were applying for jobs, they went down to about 8 or 10% because people who were using drugs just didn't bother to go there to apply for a job. They went somewhere else. So that, even though that, just using that as an analogy, that company had the right to get themselves a drug-free workplace because they were liable. If a guy ran his truck, I mean, there's less in the way of trucks, your insurance rates go down. That's one thing about employment. The employers coming around trying to get you to be vaccinated free doesn't fall in the same category to me as this drug business does, where the guy might run his truck. You know, you got a real liability issue there as an employer. If the federal government doesn't let IBM or somebody else get a testing option, now, if they don't give them a testing option, so I mean 70% or 60% or some percent is going to take the shot. If they don't let them have some option, like testing them once a week, testing them every day, or like Delta pay $200 more for your health insurance or something, I just don't see what you can do. I do not see how you can take a group of people and make 100% of them do something that at least 30% of them are dead gum against.
Well, we're not China, so it ain't happening.
All right, final thought of the day.
Well, that's
we're not
enough
China.
final thought. We're not China. That's good enough. That's good enough for me. I'll give you one more. I'm involved in a political campaign right now, and I didn't really realize that even at this level, at the
City level.
city level, 1,100 voters, that people can be petty. I just thought, I think petty doesn't get it. And that's sort of like this business we're talking about here. Authoritarian doesn't get it. I mean, we got to learn how to get along with one another, and we can't let people push us all into a box.
You done?
Totally agree.
Totally agree. We'll go with totally agree.
Go get your colonoscopy, mammogram, and your PSA.
Yes. Preventative medicine. Georgia Cancer Specialist, Northside Cancer Center, thank you for this segment. We appreciate it. Ask the doc. And when we come back, we're running a little late, but when we come back, it's going to be time for the All-Star Political Panel, and I'm going to talk about you.
Okay, you're going to skip over the All-Star Political Panel?
No,
straight to the
but
panel of the week?
I don't get a lot of opportunity to just talk about you when you're not around,
All right,
but you got to
okay,
go to
good.
work.
Go right
So
ahead.
stick around. We get back, I'm going to talk about it.
All right.
You good?
I'm good.
We're all good. Take a break.